I'm Lisa Rothfus, and I'm a psychotherapist and a licensed clinical social worker with 33 years of experience working with children and families in the Austin area. I'm extremely well trained in working with families where parents have lost their relationship with their child. In this video, I'm going to tell you about reunification, the process of reestablishing a lost relationship between a child and a parent. I work with a lot of parents in my practice every day who are experiencing problems in their relationships with their children due to divorce or custody disputes. Let's start off with a few stories about other parents who have found themselves in situations where they have lost their relationship with their children. See if any of these stories remind you of your situation. The first story I want to tell you about concerns a divorced mother with a 10-year-old daughter. She tells me that every time her daughter returns from a visit with their father, they get into very big arguments. Her daughter becomes very hostile and disrespectful, calling her names and criticizing her. She's worried that her ex is telling her daughter lots of negative things about her and that this is hurting their relationship. Does this sound familiar to you? Do you worry that someone in your child's life is saying negative things about you? How about this story? There's a father with a 12-year-old son who started saying that he didn't want to go to his dad's house anymore. The dad tried to talk to his ex-wife, but she always says, "It's up to him. I'm not going to make him go if he doesn't want to." Dad's really worried that he's losing his relationship with his son. Does this sound familiar? Do your kids no longer want to come to visit or go to your house? And how about this story? A divorced father with a 16-year-old daughter has 50-50 custody with his ex-wife. His daughter is saying that she doesn't want to live with him anymore. She wants to live with his ex-wife full-time. He thinks that his daughter doesn't want to live with him because he has more rules and expectations at his house than his ex-wife. He feels that she has no rules and very few expectations. He's terrified of losing his entire relationship with his daughter. Does that sound familiar? Do you and your ex have different parenting styles? So every day in my practice, I hear these kinds of stories where parents are losing their relationship with their children. And they're frustrated and confused, and they don't know what to do. And everything they try seems to make the situation worse. Is this you? If you're watching this video, you're probably thinking, it has to be important for me to have a relationship with my child, even if there are problems. And you're absolutely right. There is a significant body of research that points out the long-term negative effects on children, both emotionally and socially and behaviorally, when they are prevented from having relationships with both parents. I know the kind of problems many of you are facing with your children. That's why when you start to feel yourself becoming disconnected from your child, that is the time to get help. And there is a way to get help. Often building back the relationship requires a special kind of therapeutic intervention called reunification therapy. So what does reunification mean? Reunification is a term that's used often by lawyers and the court system, but parents don't really know what it means. It's a fairly new form of treatment for families dealing with high conflict situations. Reunification therapy, as it is called, is often needed when a child is starting to refuse to see a parent, is outright refusing to see a parent, or when a parent is refusing to follow the possession or visitation schedule outlined in your court documents. The goal of reunification therapy is to get children back on track, following the court orders. So if you feel a divorce or a custody dispute is causing you to lose the relationship with your child, you need to act now. The longer you wait, the more damage can be done to the relationship. In the rest of this video, I'm going to describe a 4-step plan for using reunification therapy to heal the relationship with your child. But don't think that you have to go about this alone. At the end of the video, I'll provide contact information so we can get together to discuss how you can reunify with your child. So step number 1, find a qualified reunification therapist to consult with. This person should describe the process of getting into reunification therapy for you and actually guide you through it. They should listen to your story and help you formulate a plan for implementing the reunification therapy process. This will help you determine if a lawyer is necessary. A voluntary approach is definitely possible in some situations. However, in my experience, a majority of the time, a lawyer is necessary to get the reunification process going. In difficult situations, a court order may even be necessary. When I meet with a person like you, I will help you find the right lawyer, taking into account your budget, your location, your court system, and the complexity of your case. I will coach you on what to do and what not to do relative to your child and with your ex-spouse. There are so many landmines you need to avoid to prevent the relationship with your child from deteriorating any further during this time. A good consult will help you identify what these are specifically in your case and give you specific recommendations on how to carefully proceed. It's extremely important to remember that parenting your child once you have become estranged from your child is very different than parenting your child under normal circumstances. The discipline and parenting style you previously used with your child can really backfire once estrangement has set in. Most clients that come to me don't know this, and they've been stepping on landmines for a long time. You will most likely have to change some of the ways you're currently interacting with your child and your ex-spouse if you're to prevent any further damage to your parent-child relationship. Step number 2 is to find a good lawyer. As I mentioned before, maybe you're one of the lucky ones who doesn't need a lawyer, but most do, and you're going to need to find an appropriate one. There are lots of good family law attorneys out there, but not many of them that understand issues like estrangement, alienation, and reunification therapy, or how to write a really well-structured order to make reunification successful. It's difficult to navigate all the issues involved in setting up reunification therapy without a good lawyer. Sometimes families will voluntarily agree to engage in a reunification process, but usually it has to be court-ordered, because your ex usually doesn't want to address the estrangement issues. So court orders help because the court can enforce that everyone will participate in the process and that they will be held accountable if they don't, which is really important. I've talked to many clients whose cases were badly mishandled because attorneys did not understand, number one, what key issues need to be pointed out to the court to increase the likelihood of getting a reunification order, or number two, what to put in a well-structured order that will allow a reunification therapist to do their job successfully. So preparation with your lawyer before going to court is essential. Be sure your lawyer sits down with you at least a few weeks before you go to court and identify the key issues and discuss what should be in the order. So a knowledgeable lawyer will write a successful order and start your case off right. And by the way, don't leave all the work on your case up to your lawyer. It's important that you get involved and help drive the process. If you have a good lawyer, they will be working with you, but this is your case. This may be your best or only shot at getting reunification therapy ordered for you and your child. You want to be prepared and don't let a lawyer put you off and tell you that they can't meet until a few days before going to court. That may not be enough time to prepare, and I've had this happen to a number of my clients. The third step is to find a good reunification therapist to work with you and your family. There are not many therapists that are trained in reunification therapy, and it takes a little work to find one, but it is absolutely critical that you find one that knows what they're doing. If you get a therapist that doesn't understand the complexities of these kind of cases, they're going to mess your case up. And I've seen this time and time again. Clients come to me after having met with several other therapists, many that were chosen because they were on their insurance plans, that have just caused more harm to the family situation. So don't let this be you. Take charge of the process. You and your lawyer will be asked to give a few names of therapists that could do reunification therapy, so do your homework. Find a well-trained reunification therapist to recommend to the court. When talking to the therapist, here are the kinds of qualifications you're looking for. someone who uses family therapy in their practice, not just individual therapy, someone who's used to working with high conflict divorces and custody dispute situations, because these cases are not like other counseling cases. They're much more complicated. And you want a therapist who understands and is trained in estrangement and alienation with families. You could ask what trainings they've attended around these topics. You're also going to need a therapist that treats trauma and anxiety issues. Many family members come to me and they have had experiences with trauma because of the family situation. But everyone that comes will experience anxiety over the reunification process. And finally, you'll need a therapist that is comfortable working with the court system and collaborating with lawyers. Many therapists don't want to talk with lawyers, and this is essential in this process. Another common scenario around choosing a therapist is the recommendation that the child's current individual therapist be the reunification therapist. I seriously caution against this for several reasons. This therapist may have a good connection with your child, but they haven't trained in this specialty area, and they may not realize it, but their behavior indicates a bias for one parent or the other, perhaps having spoken more to one parent than the other. It's usually best to start with a neutral therapist who will get to know the whole family equally. Finally, I often see clients who only want to look for a therapist on their individual insurance carrier. I understand wanting to do this, however, it's pretty difficult to find a therapist that will take these cases. Often you'll spend months trying to find one, and this just wastes your precious time with your child and prevents you from building back a relationship with your child sooner. So be careful about going down that road for too long. Step 4 is to start the reunification process. And it is a process. Repairing the relationship with your child isn't going to happen overnight, and it doesn't mean that you're going to jump right into meeting with your child. Having a really good process takes a lot of planning and coaching. So here's what I do with the families I work with. First, I meet with everyone and see why a child is refusing to see a parent. There could be any number of reasons for this. It could be something you did in the past. It could be something your ex-spouse is doing now. It could even be things you're doing right now without knowing it that are causing problems. It usually takes about a month or so for me to talk with everybody. And once I understand what the issues are, I start preparing and coaching everyone for the first meeting between you and your child. What does being prepared mean? Well, one of the biggest issues to deal with at the beginning of this process is the anxiety. I work with everybody to handle the anxiety they feel when we start the reunification therapy process. To reunify with your child, you're going to need a lot of coaching to prepare for the first meeting with them. You're going to need to know how to avoid stepping on landmines that could derail the session, such as talking negatively about your ex, or how to respond to some of the very difficult questions your child might ask you, like, "Why don't you give mommy more money to take care of us?" There are many cases of reunification therapy going badly because a parent wasn't well prepared to meet with their child. But the other parent also needs to be prepared and know that they're important to the process as well. If a child doesn't want to come to a session or be part of the treatment, then I'm going to need their help meeting and talking with the child. After appropriate preparation, you start meeting with your child, and we start working on real issues that cause the problems in your relationship. I try to make some of the first interactions be positive as possible, and I don't usually use the first few meetings to address the deepest issues. But eventually we will discuss the reasons a child is feeling upset, angry, or afraid of being with you. So what exactly does success mean in these kinds of situations, and how long will it take? These questions have different answers for every case, but there are a few of the success stories I've had over the years. In one case, I worked with a mom and her 15-year-old son. Unfortunately, their time together was very limited due to the very strict visitation schedule. We initially worked together in my office, and eventually they started visiting outside of my office while I continued to work with them each month in family sessions. Her son is now 17, and despite some rocky moments, their relationship has stayed strong. In another case, I worked with a 6-year-old boy to reunite with his father. At the beginning of the case, he didn't even know who his father was. But I helped the dad start a relationship with his son and to enjoy spending more and more time together. This took about 8 months, and it's still going on, but they are in the process of building a strong bond together. In a third case, I worked with 2 little girls who were refusing to see their dad after seeing him overdose. Both the mother and the girls were very worried about the dad being with them again. In this situation, everybody needed a lot of support around the anxiety they were feeling. But eventually, the girls agreed to meet with dad again, and after some family therapy work, they began to increase the length of their visits slowly, eventually doing overnights, and most recently, a 4-day visit over spring break. They're now back on schedule, seeing the dad every other weekend and once during the week. Dad is committed to treatment and takes regular drug tests. So success is absolutely possible, even in challenging situations. But I want to be honest with you and say, some cases can take a long time, sometimes 6 months to a year or more. And it's hard to know exactly how your case will go because there are many variables. I always tell clients they need to be in it for the long game and understand that patience is required in a successful reunification therapy process. Okay, so I know I've given you a lot of information, but this is an involved process, and I want you to be prepared and understand from the beginning what you're signing up for. I'm so very sorry that you found yourself in one of these situations, and you should know that it is in the best interest of your child to be part of their lives and to keep trying. Be prepared to play the long game. Even though your child can't tell you this right now, they will quite possibly look back on this as an adult and be very grateful you did not give up on having a relationship with them. As they develop and mature, their understanding of the complicated situation you are all in may change as well. And if you've hung in there and you've done your best to be with them through this process, you may have that successful outcome you're hoping for. I know this process can be overwhelming, so that's why I'm here to help. Give me a call and we'll go over your situation. My name is Lisa Rothfus, and you can reach me at 512-643-2851, or you can email me at info@lisarothfus.com, or even surf over to my website, www.lisarothfus.com. Thank you, and never give up hope.